Hello everyone, my name is Alicia Trong, and this presentation is brought to you by the team Just Add Caffeine. Our process improvement objective was to improve the amount of wait times patients had to spend while visiting for their doctor's appointment. This process improvement took place at Physio Health Clinic, in which patients would visit to see their primary care physician for follow-up visits or as a new patient encounter. The objective involved tracking the amount of time patients had to spend waiting for their appointments by using timestamps. Before our process improvement implementation, Physio Health Clinic didn't have a check-in process that would allow the clinic staff to be aware of the amount of time a patient had spent waiting for their appointment. The patient would basically walk up to the front desk, write their name on a sign-in sheet along with the time that they had arrived. This caused many problems because the front desk wouldn't always know who the patient was in the waiting room because they couldn't read their writing. The patient sometimes forgot to sign in, and there were time discrepancies. Not only did our process cause problems at the front desk, but there was no structured way to notify the back office, such as the medical assistants, that a patient was waiting. It was a verbal notification in which sometimes got miscommunicated. Once the medical assistant took the patient back and got them roomed, there was no way for the doctor to even know how long the patient had been waiting either. On the next slide, Jessica Kirby will discuss the process map, which explains the steps that a patient takes while visiting the clinic.
Hi, my name is Jessica Kirby. Here's a process map to show the steps that a patient takes while visiting the Physio Health Clinic. Currently, the patient arrives at the clinic and is supposed to sign themselves in at the front desk. Some patients are not aware of this and just have a seat thinking they will be called up to the desk eventually. There is also confusion for the front desk staff while reading the patient's handwriting and getting them properly checked in. Once the staff at the front has actually checked the patient in, the patient then waits to be called back to the patient room. After waiting for the support staff in the back to become aware of their arrival, the patients are then brought back to the patient room by the support staff. The patient then waits for the provider to enter the room to complete the exam. After the exam, the patient then waits for the provider to complete their note to properly end the visit so that the patient can leave. As you can see, there is room for improvement to help reduce or eliminate patient wait times at the Physio Health Clinic. While a perfect map would have 0 to little wait times, you can see that the current process has large wait times that we need improvement on. Our goal with the lean process improvement is to eliminate the patient wait times after the arrival to the clinic, as well as cutting the wait times after check-in, or eliminating them altogether if there are open rooms for the support staff to bring the patient back to. The wait times, once roomed and waiting for the provider to finish the visits, should be cut down as well, giving the patient a smaller wait time throughout their entire visit.
Hello, my name is Kyle Stoltz, and I will be talking about how implementing Lean at Physio Health Clinic will be able to reduce waste, improve overall satisfaction, and greatly improve workflow. Currently, Physio Health Clinic does not have a standard of work process for checking in patients, completing the necessary diagnostics prior to the provider seeing the patient, and also notifying providers when the patient is currently in the exam room and waiting to be seen. As a business that prides themselves on patient satisfaction, this is absolutely unacceptable. So, what is Lean exactly, you may ask? Lean is a philosophy that is used to produce only what is needed, when it is needed, and with no waste. It is a complete analysis of a system and the steps involved, specifically looking at the steps that will add value to a process. In the case of Physio Health Clinic, not having a working process for a checking in of a patient is essential to enact. Once a process has been enacted, Implementing lean will be able to reduce waste, which in this case is downtime for patients and eliminating confusion for the staff, improving their time efficiency. By reducing wait times, patient satisfaction will increase due to them feeling they are a priority and knowing that their time is not being needlessly wasted. For the staff, knowing exactly what to do, when to do it, and how to notify providers will increase their overall efficiency, facilitating a more effective experience for everybody involved in the process. Now, we will apply a fishbone RCA to help improve the effectiveness and efficiency at Physio Health Clinic. A fishbone RCA is a visual representation of a step-by-step problem-solving system that is aimed at correcting defects that occur during a specific process. A root cause analysis is designed to identify what went wrong, why it happened, and what can be done to prevent this issue from arising in the future. As you can see in the fishbone diagram, the main problem that has been identified is excessive wait time for patients. Some of these contributing factors to the long wait times are that there is not currently a check-in process implemented. Assistants are unaware patients are in the waiting room already checked in. There is no standard way to notify the providers that the patient is in the exam room, which leads the providers being unaware that the patient is actually waiting to be seen.
Hi, my name is Rachel. The use of timestamps to improve patient wait times ties into the DMAIC process. In order to define our improvement strategy, we have to acknowledge that our problem is wait times. The timestamps will show each period of the appointment that the patient is waiting around. In order to measure these, we will have logs of timestamps and add up the total time the patient has been waiting in the end. In order to analyze the data, we will first look at each point of the appointment and see what is taking the longest. We will compare our findings to our average wait time goal and see how much improvement is needed. In order to improve our patient wait times, we will focus on the longest period between timestamps and see what areas need improvement. We will then come up with ways to improve those longer periods. The control portion of the DMAIC process is to continue using the stamp method to see if we are keeping patient wait times down or if we are falling back into longer wait times.
The 5 S's are part of the lean process and are ways to ensure that there is a well-organized and clean workplace. Since Physio Health Clinic did not have an organized check-in process, the change to improve patient wait times needs to start here. The first S is to sort, which means to take out any unnecessary steps and items from the workplace. At the Physio Health Clinic, the sign-in sheet was just causing confusion for the front desk staff with trouble in reading the patient's handwriting, as well as confusion on time of arrival. Removing this process and having the patients physically check in with the front desk staff gives the patients the reassurance knowing that the staff knows that they are there, as well as letting the support staff in the back aware that the patient is here and ready to be seen. This can eliminate extra wait time for the patient that would currently been waiting for the staff to come or be aware of their presence. The next step is to set in order. For this step, you want to arrange the necessary items and give the patient visual cues. For the clinic, having signs leading the patients on where they need to check in and the proper check-in process, as well as signs letting them know that they need to speak with the front desk staff upon their arrival. For the shine step, you want to make sure that the front desk area, as well as the patient rooms, are clean and clear of clutter or any unnecessary items. Having the waiting areas clean and the patient's room cleaned and well organized will cut down on wait times for staff to find things that are required during the patient's visit, as well as any confusion at the front desk during check-in. To standardize, which is the next step, the clinic will want to make sure that the staff is aware of the new proper check-in procedures, as well as having the patient's room stocked and organized, which would eliminate any wasted time looking for supplies during the visit or having the support staff leave the room because the room isn't properly stocked with all the necessary equipment. And last, you want to sustain. For this, you want to make sure that the staff is aware and will follow the above S's on a regular basis. This process is not a quick one-time fix, but rather steps and procedures that need to be sustained and maintained for shorter wait times throughout the clinic.
Our process improvement implementation of timestamps required both the front office and the back office to coordinate the patient's flow through the clinic. The timestamp would begin at the front desk by having the patient check in with the front desk representative in order to be checked in. The front desk would check the patient's appointment time to checked in through our electronic health record called Medrium. The back office would then get a notification through Medrium that a patient had been checked in and is waiting. The back office and or the medical assistants would then have to prepare to take the patient back to the room. Once the patient was roomed and ready to see their physician, the medical assistant would then have to record the patient's encounter as well as the time the physician went in to see the patient. Once the appointment was concluded, the patient would then be sent to the reception area in which they would schedule their follow-up visit, and another timestamp would be entered in Medrium by having the patient's appointment set to completed. This allowed us to have real data that would show how much total time a patient had spent waiting while visiting the clinic. The time log below shows what data was collected during our process improvement implementation of timestamps. The data collected the time the patient arrived to the clinic, the patient's actual scheduled appointment time, the time the patient was roomed, the time that the physician entered the room to see the patient, the time the encounter with the doctor was concluded, and the time that the patient had checked out. The recorded waiting times that we had used for our data was the time the patient spent waiting to be roomed after their scheduled appointment time, the time the patient spent waiting for the doctor after being roomed, and the time the patient had to spend waiting to be checked out after they were done with their doctor's visit. This gave us the total time a patient had to spend waiting during their visit to the clinic.
We found that on average, patients are waiting 13 minutes during their appointment. The use of timestamps has allowed the clinic to be able to see who is waiting and give a more organized check-in process. Without timestamps, we have no way of knowing how much the patient's time we are wasting, and we also hadn't known how long patients' appointments were averaging with wait time on top of that. Timestamps are a great way to help understand why patients are waiting so long and helps us focus on correcting the areas that need changed in order to give patients a faster appointment and not waste as much of their time. In conclusion, the use of timestamps has worked well within our clinic and helped the patient's wait time be reduced. Thank you.